Good afternoon, everyone. Afternoon. Yeah, afternoon. Yeah. Have you taken your lunch yet? No, not yet. Okay, don't worry. Later after the session, we have something to eat. Yeah, all right. Okay. Thanks for coming over today for another session of talks by Dr. Amir Farid on Supercharge Your Health. Okay. Something that is very special, something that's very unique and very useful for your health. Today, give yourself a clap. Okay. Thanks for coming and getting this information on how this device can help you and your family members. All right. Now, okay. First of all, I would like to invite our representative from three countries today to come at the front to introduce themselves. Okay. So I would like to invite May from Singapore, our Singapore representative. Yeah, please welcome May. Yeah. Okay. Okay, and second, Mr. Shahid from Saudi Arabia. Yeah, Mr. Shahid, please come forward. Yeah, and also Dr. Enery. Yeah, from the Philippines. Yeah, yeah. Come to the front. Yeah, come to the front. I don't. Uh, you want to? Okay, maybe you come to the center. Yeah, come to the center. Yeah. Okay. May will be our representative doing our this device. Basically, she's operating in Singapore. Okay. So I'll pass my mic to May to introduce herself to say a few words. Okay, May.
Hi, I'm May Liu. So I'm representative for Singapore licensees.
Okay. Thank you. Thank you, May.
Thank you. Anything,
Yeah.
anything in Singapore, look for me.
Anything Singapore, look for May. Yeah. Volume. Yeah. Yeah, no, but this is for a Zoom. Yeah. Okay. Next, I'll pass the mic to Dr. Enery from the Philippines.
Yeah, hello. I should say mabuhay. Buhay from the Philippines. I'm Dr. Anna Toledo, and I'm very, very honored to be part of this pioneering and going to be gigantic. Yeah, yeah, and powerful. Genergy.net. Yes. Thank you so much.
Next, introduce you to Mr. Shahid from the Saudi Arabia.
Assalamu alaikum. Good afternoon, everybody. Thank you very much. I don't know how to start with. It has to be only 1 minute, correct? Yeah. Yesterday, I called a very close friend of mine, and I start talking about the product. So first question he asked me, do you have an office in Saudi Arabia? I said, I think we have office in every house in Saudi Arabia. He said, what do you mean like that? Because every household needs it. So why do you need an office? So that's what I understood, being a health product. So much of challenges all around on our health conditions. So something like this is very important to be in a family, not just to be an office. Thank you very much. Thank you.
Okay, thank you, gentlemen. Thank you. Thank you. Thanks, May. Okay, without further ado, let me introduce to you the star of today, Dr. Amir Farid. Let me brief a bit on his background. Okay, Dr. Amir Farid, he is basically a gynae, a specialist gynae. Okay, but he is a doctor who do not just believe in medicine. Okay, so he believe in natural healing path, qigong, how to heal his patient, not just depends on this medication. He looked for alternative medications, alternative ways to heal his patients. All right. So Dr. Amir Farid, basically, he's one of the pioneer in practicing holistic integrative medicines, combining all kinds of stem cells, holistics, all kinds of these medicines. All right. He is also doing this qigong. So he is also the founding qigong master and has been teaching qigong for 35 years. Okay, and he is also now the remain as an advisor. Besides that, okay, he doctor Amir Farid, he also writes on the Stars newspaper. Okay, he's a columnist. Okay, for more than 10 years. Okay, let me introduce to you. Put your hands together. Please welcome Dr. Amir Farid to give his talk today.
Thank you. Thank you very much for the kind introduction. Is the sound okay? Okay, I need to see this. Okay. You all can hear me well? Okay. Okay. So the topic I'm going to share with you is on PEMF. But just in case there are some of you who may not know what PEMF is, let us start from scratch, from the beginning. And for those of you who already know, regard it as revision. Okay. So what will I share with you today, and hopefully that you will learn, is that what is EMF or EMS, then what are the harms versus the benefits of EMF, and what is PEMF and how does it work, and the benefits of PEMF therapy. Okay. So when we talk about EMF, we better know what we mean. And in the subject of EMF, there may be some terms used that may confuse you. There is EMF. Some would refer to that as electromagnetic frequencies. So I'll explain in more detail about all the different terms. As you can see in this diagram, so you can see all the waves that come to us, which affects our lives. Everything you do. I'm speaking to you, there's sound waves going to you. I'm looking at you, looking at me, there's light waves coming between us. That's why we can see each other. All right, your handphone, and the machine that you're sitting on, all have got to do with these frequencies. Each one of them are different because they have different frequencies and different wavelengths, you can see. Okay, so the EMF refer to the different type of waves with different frequencies, EMF. But another meaning for EMF is electromagnetic fields, because all these waves, they carry energy and they also generate a field. Right? Whenever there's energy, there's a field. Right? You and I, we are human beings. We have energy, and there's an energy field around each one of us. Okay? So EMF means both electromagnetic frequencies, electromagnetic field. So if you want to be specific, then you have to say what you're talking about. But in general, because all the frequencies generate the fields, so it's all right just to talk about EMF. It means both. And then you have electromagnetic radiation, because all these, another way of talking about waves, they are forms of radiation, something that radiates. Okay, so all the waves are forms of radiation. So you have EMR. So EMF is also called EMR. Okay. And then you have EMS, electromagnetic spectrum, because when you talk about the different frequencies and wavelengths across this spectrum of waves, so the whole thing is called the electromagnetic spectrum. Okay, so now you know when people talk about what is EMS, what is EMR, what is EMF. Okay, later on in the talk we find another EMS which have totally different meaning. Okay, and to give some rough idea the types of frequencies of our different gadgets emit, then you have the pictures below. Okay, so this is in more detail, all the different gadgets. But when we talk about frequencies, we're talking about now we refer to the electricity frequency. We're talking about the frequency when you talk about AC, alternating current. There is an alternation. You know that there's a wave. Okay, but you know there's a battery. Yeah, your battery also generates electricity, but it is direct current, right? There's no alternating. So zero frequency. Okay, so when you talk about electricity, when you talk about frequency, you're talking only about the AC. So our household electricity is in the 50 to 60 hertz. Hertz is cycles per second. Okay, cycles per second. When you talk about direct current, there is no frequency. Right? On the other end, you have all the X-rays and the gamma. So you can see those that are very, very, very uh, uh, high frequencies are the ones that have radioactivity. That's all. And they can ionize. That means they hit an atom, they cause the atom to split into molecules and atoms, they cause to split because they are so powerful. So they are called ionizing radiation. And in general, they are harmful. Whereas on this side, they are non-ionizing and safe. Okay. So are EMFs harmful to our health in general? Yes. That's why I'm sure you've heard so much talk about whether our handphone radiation is harmful. So there's a lot of talk, a lot of controversy, just like the controversy about cigarette smoking. Until now, most of the tobacco companies say no, they are harmless. So this depends on who you ask. All the companies that produce all the electronic gadgets say no, don't worry, they are harmless. But all the science shows that they are potentially harmful. Okay, so it has been shown that different types of animals and humans are sensitive to minor exposure to electromagnetic fields, and there is much public concern about the possible effects of exposure to EMF on human health for many years, and there are conflicting scientific views and expert opinions on whether we should be worried about the harmful effects, especially because there are also those with vested interest. Okay, but just remember, yes, most EMF are harmful. Okay, so what kind of harmful effects? It could be even damage on your genes, so causing cancer, and then even on the brain, causing behavioral changes, and then on your sleep pattern, on your heart and your hormones, on your immune system, causing autoimmunity, even affecting your fertility, and many, many negative effects. All right. So most will affect your health and even your rate of aging, meaning it will worsen make you age faster. On the other hand, are there safe or beneficial EMF? Okay. Extremely low frequency electromagnetic fields in the range of 1 to 100 are deemed to be generally safe, but not always so. Okay. Remember in the electromagnetic spectrum, on the high frequency side, more harmful. On the very low side, they are harmless. Okay, but not all are harmless. It also depends on how much exposure you get, and what kind of we talk about current. What kind of current? Low frequency, but huge, very very high voltage also can harm. For example, the power transmission frequency of 50 to 60 hertz, which is our household frequency, is all around us. But the EMF produced by a high voltage power transmission line can generate current and magnetic fields inside our body and can impact our health. Indeed, there are individuals who are significantly affected by such power lines. There are families who have had to move away from where they are because of the power lines, and several members of the family are affected. There are cases where 1, 2, 3 members of the family had cancer. And I'm talking about the cases that I know here in KL. So when that happened, it becomes prominent. We read about them. Okay. Now we move on to what is the Earth's natural frequency. So the Earth also has natural frequency, and the Earth's natural frequency is 7.83 cycles per second or hertz. And this is called the Schumann resonance, or the Schumann frequency. So which means the Earth is pulsating at that frequency. And it surrounds and protects all living things on the planet. So if it protects, that means this frequency is beneficial, good for health. Scientific studies show that the human brain reaches its ultimate potential for health and wellness when it resonates with this frequency. And many studies show that the Schumann frequency has been linked to improved cognitive functions, reduced stress and anxiety, and enhanced immune function, sleep function, and much more. Okay, so it has many benefits. So if we can sync ourselves with this frequency, all right, then it should positively affect our health and mental well-being and our daily performance and promote overall well-being. Okay. Unfortunately, while the Earth is pulsating at that frequency, on top of the Earth, that us and everything else around us also are producing all sorts of harmful frequencies that is polluting and fighting against this a background frequency. So unfortunately, the Schumann resonance may be blocked out from reaching us by the massive amounts of EMF radiation that are emitted every minute of every day by every gadget that we have and all around us. High voltage energy transmission lines and substations are plentiful in big cities, and people living in those areas are subjected to strong electromagnetic fields. Various health issues have arisen, including cancer, as mentioned earlier on. And studies show that EMF emitted from electrical and mechanical appliances in our homes and workplaces, such as heating systems and air conditioning, and the ubiquitous mobile phones, may interfere with the body's ability to stay in sync with the Earth's natural vibrations. Okay? So even though the Earth is huge, but the number of gadgets we have emitting all sorts of frequencies is just, it's just enormous. You don't know how many billion of these gadgets are producing these frequencies. So this interference can negatively affect the body's immune system, energy levels, sleep quality, and other health factors. So the overall health and defense, our overall health and defense are at risk. It could be one of the reasons why so many people often feel stressed and anxious, and why many become sick easily. So my daughter is a doctor working in the forensic department. She cuts up dead bodies. Some of the gory stories, there are people committing suicide, jumping from 23rd floor, 32nd floor. Okay, and by the time that the body come to her, all right, the brain is in the back, all mashed up like potato, mashed potato, and then she has to sift through. And the other day she was telling me she was seeing she felt something hard. She took out, oh, it was a credit card, all mashed up in the brain. So there are a lot of people still, they're committing suicide. And that's the worst case scenario. But the ones who are not committing suicide, but doing other things in their stress, they don't kill themselves, but they go and kill others. That cause so much problem. There's so many people stress. And in USA, all the antidepressants and anti-anxiety drugs and number one sellers. Okay. So restoring the body's frequencies to sync with the Schumann resonance may help restore health, right? So if we can, somehow, restore back, our body's frequency to sync with the Earth's frequency, that should help us tremendously against all these other harmful frequencies. Okay, so what are the beneficial effects of EMF if you get the right frequency? Studies have shown that connective tissues generate weak currents when mechanically stressed, and therefore, the scientists have come up with the idea of making pulsed electromagnetic fields. So the PEMF stands for pulsed electromagnetic fields, right? So scientists make these gadgets which are designed to induce currents similar to those produced normally during mechanical deformation of connective tissues. Okay, so they discovered that when our body is injured or is stressed, then the body produces weak currents to start the healing process. So the scientists try to mimic these weak currents. These weak, time-varying magnetic fields have beneficial effects on cell function. A wide variety of challenging musculoskeletal disorders have been treated successfully over the past 2 decades. So what I am quoting here, past 2 decades, was in 1993. That means this is an old story. So by now it's already 5 decades, right? So for more than 5 decades, the doctors in the hospitals have been using PEMF for healing, especially for musculoskeletal problems, especially for fractures that cannot heal by all the other non-medical methods. PEMF can heal, can make the bones join. So that's a clue. This is something not, you cannot ignore this, all right? And in Singapore, they would say, no play. This is something magical. Okay. And even 30 years ago, they already made this statement. More than 250,000 patients with chronically ununited fractures have benefited worldwide from this surgically non-invasive method without any risk, without discomfort, or the high cost of operative repair. And by now, 30 years later, there must be millions and millions who have benefited from this technology. And since then, many other therapeutic uses of PEMF have been applied, some supported by double-blind clinical trials. So why I mentioned double-blind clinical trials? So in the end, we want it to be evidence-based. We make any claim, there must be studies, and the gold standard of studies is double-blind clinical studies. As understanding of the subject expands, the range of treatable conditions have increased tremendously, right? So from just fractures and musculoskeletal problems, now it has been extended to nerve regeneration, wound healing, graft behavior, graft means tissue graft, diabetes, myocardial and cerebral ischemia, that means heart attack and stroke, and many more. There is even possible benefits in controlling cancer. Right? It is already used to relieve bone, nerve, and tissue pain in cancer patients due to the cancer or the treatments. Cancer treatments also harm the patients, but now we are talking about controlling and treating the cancer itself also. So there are ongoing studies. So now let's go into more detail. What is PEMF, and how does it work? Okay. So earlier on, I say that frequencies will generate fields. So electricity has frequencies. So electricity will generate an electromagnetic field around it. So and the machines that you're sitting on, all right, the machines uses electric currents to generate the pulsed EMF or PEMF field, which influences tissues in 2 ways. Firstly, the magnetic field creates a force on tissue-resided molecules, right? So in your tissues, there are iron and there are manganese, which respond to magnetism. Okay, so the magnetic fields generated there will influence these molecules. All right, so which depend on their magnetic reactive properties, and the magnetic field can be demonstrated using small magnets. So afterward, Mervyn will show you or prove to you that there is magnetic field around the machine when it is on. Secondly, the induced electrical field exerts a force on the ions present in the tissues, and both result in a forced movement of ions or charged particles such as proteins. So why we're talking about that? Because for healing to happen, some molecules have to move. Yeah, the body have to bring in the repair molecules to heal. Okay, so from the name you have pass electromagnetic field. So there is electrical field, there is also magnetic field. So both will give benefits. Low frequency electrical fields do not penetrate well into tissue, instead favoring the development of an electric current on the surface. However, applied penetrating magnetic fields, okay, now if you just rely on the electric field, then it will not go deep. But if there is magnetic field can go much deeper. So however, applied penetrating magnetic fields can be used to induce an electrical field in deeper tissues in PEMF therapy. Okay, now, electricity generate electromagnetic field. Okay, and the magnetic component can go deep into your tissue, right? So the pulse magnetic field then generate an electrical current. You see, right? Electricity generate magnetic field generate electric current. That is how, in the end, deep inside your tissue, you get both the magnetic field and the electric field. Okay, but the electric field is not from the original electricity. You understand this? All right, electricity is secondary to the magnetic field that's generated by the electricity. So this is the wonder of the PEMF. You don't even have to be in contact with the machine. But the closer you are, of course, the more is the strength. So that means, the closest it will be if you are in contact, but it's not necessary. Whereas if it's an electrical gadget, you have to be in contact. Otherwise, the current cannot flow to you. All right, so that's the difference. Okay, so this in PEMF therapy, the effect can be up to 10 to 15 cm or 4 to 6 inches, right, from the source. And there are no tissue barriers, unlike when using other methods. Okay, if you just electricity, you can block electricity. Right? You can block electricity, but you cannot block magnetic field. You cannot block magnetic field. Right? Even radiation, you can block. That's why when you go for X-rays, you see you are given a lead coat, right? Right? It is a barrier against the radiation. But you cannot block magnetism. You cannot block magnetic field. So that, which means there's no barrier to the healing effects of the magnetic field from this machine. A pulsed low magnetic field is twice as effective as a static magnetic field. All right. So take note of that. So why it is not just EMF machine? It is PEMF machine because the scientists find out that if you pulse it, right, it doubles the efficacy. Okay. So now, just to explain to you, share with you, how to imagine what is pulse. If you have a torchlight, all right, so there's continuous light, right? Okay. But, when an ambulance comes through, when they want to create attention, is the light blinking or is on all the time? Blinking. Now you can understand. So, right, the blinking light is the pulse light. Right? Likewise, right, the pulse electromagnetic field is twice as effective as a static field. Right, just as the pulse blinking light is twice as effective as ordinary light if you want to get your attention. All right, it's just easy to understand. So what is PEMF therapy? So it has effects on the human cellular, on the body's cellular and biophysical systems. The therapeutic exposure times may vary from a few minutes up to several hours. So this machine, for example, is programmed for maximum 2 hours. Okay. And repeated applications over a prolonged period of more than 10 days show a higher effect than shorter periods. So this is guideline how to maximize the benefit. Okay. Try to have a continuous use from the indication here, at least 10 days before you want to take a break, right? But even you don't take a break also, there's no harm. You can have it every day. Positive clinical effects, that is promoting healing, of this non-invasive treatment on patients have been repeatedly observed, mainly in orthopedics and also other systems now, right? Initially, it was mainly in orthopedic patients. And there are ongoing studies on the use of PEMF therapies for many other health problems. But what is most important is this. Low-intensity PEMF therapy is safe, no side effects. All right, so the equally important aspect of talking about this method is it is safety. Okay, now you will be often asked me that also. There are many gadgets outside there talking that I use electric therapy. So I just want to explain to you the differences and how PEMF compare with them. Okay, electric therapy is where electrical current is passed directly to the body by contact. Okay, all right, and it affects the skin, the nerves, the muscles, tissues, and the receptors that the electrical current goes. Example, you must have heard of the TENS, a transcutaneous electrical nerve stimulation. All right, either mostly to relieve pain, but sometimes also to help recovery from other problems. So this uses low voltage electrical currents to relieve pain by stimulating nerves and blocking pain signals. And then there's EMS. Remember earlier on I said there is also another EMS that's not electromagnetic spectrum. So this EMS is electrical muscle stimulation, also EMS, right? So this is also another form of electric therapy. Instead of trying to stimulate the nerves as your target, it's trying to stimulate the muscles to help muscle recovery, right? So stimulate muscles to improve strength, reduce spasticity, or aid recovery after injury. So in electric therapy, you can have low voltage and low current, example, TENS and EMS. You have high voltage, low current, right? I'm sure all of you know of the gadget where you sit on a chair on a pad, okay, and attached to a machine that generates current, right? And while you're sitting there, nobody can touch you. Otherwise, there's sparks flying right now. Okay, that's high voltage, low current. Okay, and that's also an option: low voltage, high current. Many years ago, I went to Beijing. One company sponsored me to go to Beijing to evaluate this kind of therapy. So that therapy, low voltage, high current, is direct from the AC. Okay, and they go to the machine, but then the current is cut down. The difference between high voltage, low current and low voltage, high current is the therapist now is electrified for the last method, low voltage, high current, right? The therapist must be trained to be able to withstand higher and higher levels of current. Okay, so the therapist is electrified, of course, and then wear the conducting gloves. Right, and healing is by the therapist touching you, and you'll feel the current, the buzzing. Okay, but it's interesting. So there are many types. All right, for those who know physics, how this is the difference is manipulated is controlled by that equation. All right, current equals voltage divided by resistance. Okay. And then you have electric field therapy. So just now is direct electrical current. But electrical current also produces electric field, electromagnetic field. All right. So there's one type of therapy, then they utilizes the electric fields to interact with the body tissues and promote health and healing. So low frequency electric fields may influence wound healing and tissue regeneration, just like magnetic field. Okay. And now there are studies using this method to fight cancer. To fight cancer. Okay, so electric field therapy is now being studied to fight cancer. And then you have magnetic therapy or magnetic field therapy, right? Okay, but this is static magnetic fields. Remember, PEMF is pulse. This is static magnetic fields to influence health and cells of cells and tissues. So magnets are used, and I'm sure you've seen magnetic bracelets, magnetic pads, mattresses, etc., etc. So many magnetic gadgets have been marketed to help improve circulation, reduce pain, or promote general health. Okay, and then you all are familiar with MRI. You go to the hospital, MRI, which is magnetic resonance imaging. All right. That is for diagnosis, right? So it's not for therapy. But how does it work? Okay, it utilizes the differential magnetic response or behavior of healthy cells versus disease, or let's say tissues. Okay, so from the difference magnetic response after the magnetic fields are let's say shown on the body, and then the different response between the healthy and the unhealthy tissues will be seen, and that's how you make the diagnosis. Okay, one step further than that is magnetic resonance therapy, utilizing the same knowledge that healthy and diseased cells behave differently under a magnetic field, right? Then you can now use that knowledge for healing. I was fortunate. Again, many years back, I went to India to meet the inventor of this machine called the cytotron, which uses. Well, if you don't know, if you know from outside, you will think that, oh, it is MRI machine, but actually it's not. It is a cytotron because it's almost exactly the same thing, but the magnetic field is not used for diagnosis, but for treating. Okay, so they have excellent results with regenerating cartilage, osteoarthritis, and they have good results also with cancer. But the machines cost by now, I think maybe 2 to 3 million. RM lah. So let's stick to okay. So how does PEMF come in compared to all the three mentioned just now? Electric therapy, electrical field therapy, and static magnetic therapy. So PEMF, you get the benefits of both electric field and magnetic field therapies. Okay. One, field effect gives broader health benefits than direct current stimulation. So it is superior to electric therapy. Number two, field effect extends deeper into tissues than direct current. Okay, because especially by using the magnetic field, then you can go deeper compared to electrical field. All right, and there are no barriers. Electrical field can be stopped. Then pulse EMF, that is the PEMF, is more effective, at least twice more effective than the static fields. Okay. And most importantly, for us doctors, the PEMF is the most scientifically validated for health and healing effects compared to the other methods. You can claim, but in the end, it must be backed by studies. Okay, so this the partial list of some of the scientific studies done in the last 30 years. The ones that I underline are the ones that are not related to musculoskeletal, because there's many studies on bone and muscle, because but as mentioned earlier on, millions have benefited from this technology. Yeah, in the orthopedic, in the non-orthopedic department. So these are other studies. All right, including now stem cells. So with all these studies, so what are the known benefits of PEMF therapy? So this is what we have now, not just the orthopedic problems, but also skin problems, diabetic problem, not just the ulcers, but also the vascular and the nerve problems, the nerve regeneration, right? Lowering cholesterol, immunity, prostatitis, and benign prostatic hyperplasia, stress, helps in detoxification. And the ones that I put in red on the right side are the ones that, as more and more studies come out, you will find that the mainstream doctors will start paying attention, because these are the main problems that keep on recurring. Heart attack until now also still the #1 cause of death in many countries. And then you have stroke, and then you have cancers, and then you have neurodegenerative diseases. As the population ages, you're going to see more people with Alzheimer's, Parkinson's, ALS is amyotrophic lateral sclerosis, or Lou Gehrig's disease, where our most famous footballer, Mokhtar Dahari, suffered from that. Okay, and then more mundane but frequent problems: sleep disorders, headaches, hair loss. Okay, and the most important problem for men, erectile dysfunction. so you better sleep clutching the machine. Okay, so there are many benefits, a lot more to be discovered, meaning to be proven by studies. But if you have the machine, you don't have to wait for the study. You can experiment yourself. And who cares if the studies have not come out yet to say that it works on something? If it works on you, who cares? Okay, so in conclusion, PEMF therapy is a safe, convenient, and affordable non-invasive science and evidence-based method to enhance health and improve healing. Thank you very much.